my name is Rosalind Owen. This is going to be my head-to-toe checkoff for the University of Memphis fall of 2022. It is November 4th, and I'm going to have my camera person go ahead and scan the room at this time.
Okay.
These are all my supplies. Alright, now I'm going to scan the floor. Perfect. Throughout this head-to-toe examination, I'll be assessing the skin for color, warmth, edema, temperature, texture, turgor, bruises, scars, lesions, and nevi. I'll be assessing this in the face, head, neck, anterior, posterior, the chest, the abdomen, and in my upper and lower extremities. I'm going to go ahead and inspect my patient's head, checking for size, shape, symmetry, midline position. I'm going to go ahead and inspect the scalp, checking for hair distribution, color, and texture. I'm going to go ahead and palpate for any lesions, masks, tenderness, depressions, any infestations. I'm going to go ahead and palpate the temporal arteries. Going on to the lymph nodes, I'm going to check preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Moving on to assessing for TMJ, I'm going to have the patient open and close their jaw. Perfect. Now I'm going to assess cranial nerve 5, trigeminal. For the motor part, I'm going to have the patient clench his jaw. Perfect. For the sensory part, I'm going to have the patient close his eyes and have him tell me where I'm touching him.
Forehead, nose, right cheek, left cheek, chin.
Perfect. Now I'm going to be assessing cranial nerve 7, which is the facial nerve. I'm going to have the patient smile, frown, raise their eyebrows, puff their cheeks, pucker their lips. Perfect. Moving on to the ears, I'm inspecting the ears. Going to go ahead and inspect and palpate the tragus and pinnae for any masses or tenderness. I'm going to go ahead and use my otoscope, and I'll be assessing the tympanic membrane and the auditory canal for any discharge, pulling the auricle up and back. Good. Check the other side. Good. Now I'm going to be assessing cranial nerve. Cranial nerve 8, which is the acoustic nerve, acoustic nerve. I'm going to have the patient close one ear, and I'm going to have him I'm going to whisper 3 words to him.
1, 2, 3.
Other ear.
A, B, C.
Perfect. Moving on to the eyes, I'm going to go ahead and inspect for the eyelashes, the eyebrows, and the palpable fissures. I'm going to go ahead and pull down, looking for the sclera and the conjunctiva for any discharge, color, or lesions. I'm going to go ahead and use my ophthalmoscope, and I'll be assessing cranial nerve 2 first, which is the optic nerve, and I'll be assessing for gross vision acuity. I'm going to have the patient have a handheld Snellen chart, cover up one eye, and have him read the lowest line he can.
L, T, F, P, H.
Perfect. Other guy.
L, T, F, P, H.
Perfect. All right. Now I'm going to be assessing central and peripheral vision. I'm going to have the patient close one eye and have him tell me when my fingers come into his line of vision.
Now. Now.
Other eye.
Now.
Perfect.
Now.
Perfect. Moving on, I'm going to be checking for the red reflex and the optic nerve, or the optic disc, making sure that it's sharp, and the first thing I'm going to do is look at the pupils, checking for cranial nerve 3, which is the oculomotor nerve. So I'm going to have you just stare ahead. Perfect. Perfect. Pupils are round and reactive to light. To check for accommodation, I'm going to have the patient look at something behind me and then look at my finger. Perfect. Assessing for cranial nerve 3 again, oculomotor, 4 trochlear, and 6 abducens. I'm going to have the patient look at my finger or follow my finger with their eyes. Perfect. And now I'm going to be assessing for the red reflex and the optic disc, making sure that it's sharp. Perfect. Good. All right. Moving on to the mouth, I'm going to be inspecting the lips, teeth, tongue, under the tongue, the palate, buccal mucosa, posterior pharynx, the uvula. I'm going to go ahead and assess for cranial nerve 9, which is the glossopharyngeal nerve, and cranial nerve 10, vagus. I'm going to have the patient open up his mouth, stick out his tongue, and say, ah. Perfect. And I'm just making sure that the uvula and the palate both rise symmetrically. I'm also assessing for cranial nerve 12, which is the hypoglossal nerve, making sure that the tongue is midline without vasculations, which it is. Moving on to the nose, I'm going to make sure that the nose is midline and straight. I'm going to go ahead and assess cranial nerve 1, which is the olfactory nerve. I'm going to have the patient close his eyes and tell me what he is smelling.
Alcohol.
Perfect. Now?
Coffee.
Perfect. Moving on, I'm going to assess nasal patency. I'm going to have the patient close one nostril, breathe in and out. Perfect. Other nostril. Perfect. And now I'm just going to be palpating the temporal and frontal sinuses. Moving on to the throat, I'm going to go ahead and inspect and palpate the thyroid. I'm going to have a patient and palpate for, the trachea. And now I'm going to palpate for the thyroid, making sure that the patient tucks his head and swallows for me. Perfect. I'm going to assess the carotid one at a time. Good. Good. I'm now going to use the bell of my stethoscope to assess for any bruise. Good. Moving on to the posterior of the chest, I'm going to have you kind of angle your back towards the camera. I'll be assessing for any signs of respiratory distress, such as tachypnea, cyanosis, nasal flaring, tripod positioning, use of accessory muscles, looking for obvious signs of deformity and symmetry. I'm going to go ahead and palpate for symmetry. I'm going to have the patient breathe in and out. Perfect. I'm also going to be assessing or palpating for tactile fremitus. So every time you feel me touch your back, I want you to say 99.
99. 99. 99. 99.
Perfect. The next thing I'm going to do, I'm going to go ahead and auscultate for the breath sounds. And I just want you to take a deep breath in and out for me. Perfect. Now I'm making sure to go into the lower lobes and checking bilaterally as well. Next thing I'm going to do is I'm going to check for agophony, bronchophony, and the whisper pectoriloquy test. So I'm going to have you say E every time you feel me touch your back, okay?
E, 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 E.
Perfect. Now I want you to say 99.
99, 99, 99, 99, 99, 99, 99, 99.
Perfect. Now I want you to whisper 1, 2, 3. Perfect. Now I'm going to go ahead and percuss. Perfect. You can go ahead and turn around and face the camera again. Same thing with the anterior part of the chest, looking for obvious signs of deformity and symmetry. I'm gonna go ahead and palpate for chest expansion again. Take a deep breath in and out. Perfect. Same thing, palpating for tactile firmitus, so say 99.
99, 99, 99.
Perfect. And same thing, I'm just gonna auscultate his breath sounds. Perfect. Moving on to the heart, I'm going to go ahead and auscultate the 5 areas with both the bell and the diaphragm of my stethoscope, starting with the aortic valve, second intercostal space, right sternal border, pulmonic valve, second intercostal space, left sternal border, Erb's point, second intercostal space, lower or left sternal border, tricuspid valve, fourth intercostal space, lower left sternal border, and then the mitral valve, fifth intercostal space, medial to the midclavicular line. Switching to the bell, so aortic, pulmonic, Erb's, tricuspid, mitral. Perfect. I'm gonna go ahead and I'm gonna have you go ahead and lay down at a 30 to 40 degree angle. And I'll be assessing each side for any signs of JVD. And I don't. I'm inspecting for any heaves, lifts. I don't. I'm going to go ahead and palpate in those 5 same areas again that I auscultated. So aortic, pulmonic, Erb's, tricuspid, mitral. Perfect. I would also go ahead and identify and palpate the PMI. And I would listen for a full minute, noting the rate and the rhythm, so 60 beats per minute, regular rhythm. And now I'm going to go ahead and auscultate again using both the bell and the diaphragm of my stethoscope. So aortic, pulmonic, Erb's, tricuspid, mitral. Switching to the bell, aortic, pulmonic, Erb's, tricuspid, mitral. For the privacy of my patient, I will be leaving his shirt on for the abdominal assessment, but I would make sure to inspect for contour and symmetry. I'm going to go ahead and listen with my bell of my stethoscope, and I'll be listening to the aorta for any bruits, the renal arteries, iliac arteries, and the femoral arteries. Now I'm going to switch to the diaphragm and listen to bowel sounds starting in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Now I'm going to go ahead and percuss, and I'm just checking for any signs of tympany, flatness, dullness. And I'm now going to palpate for any tenderness, masses. I'm also going to palpate for the liver and spleen. Is any of that tender? Perfect. Now you can go ahead and sit back up. Now I'll be assessing for CBA tenderness. Let me know if this is tender.
No. No.
Perfect. Moving on to the musculoskeletal system, I'll be going ahead and inspecting and palpating the joints in the shoulders, the elbows, wrists and fingers, the hips, knees, ankles, and toes. I'm going to have you remove your shoes real quick. And your socks if you don't mind. Alright. While I'm down here, I'm going to go ahead and check capillary refill in the toes. I'm also going to palpate for the posterior or the dorsalis pedal pulses and the posterior tibial. Same thing in the fingers, checking capillary refill and the radial pulses as well. Perfect. Now I'm going to go ahead and assess range of motion. So starting in the fingers, I'm going to have you flex, extend, hyperextend, abduct, adduct, and then check your, perfect, using, checking his thumb to his pinky. Same with the wrist, I'm going to have you flex, extend, hyperextend, ulnar deviation, radial deviation, and rotation. Perfect. Moving on to the biceps, I'm going to have you flex, extend, hyperextend. Moving on to the shoulders, I'm going to have you flex, extend, hyperextend, internal rotation, external rotation, abduction, abduction, circumduction. Perfect. Moving on to the toes, checking their range of motion as well. I'm going to have you bend them, so flexion, extension, hyperextension, separate them, abduction, abduction. Perfect. Checking your range of motion in the ankles, I might have you dorsiflex, plantar flex. Perfect. And then inversion, eversion, rotation. Perfect. Moving on to strength of the extremities. I'm going to be checking for, I want you to push down. Perfect. And then push down. Perfect. I'm just checking range of motion of the ankles. Moving on to the knees, I'm going to have you try and abduct or lift. Perfect. Flex. Good. Sorry. For the knees, I'm going to have you try and abduct, and then abduct, or sorry, range of motion of the hips. And then for the biceps, I'm going to have you try and flex, extend. Good. Checking for cranial nerve 11, which is the spinal accessory nerve, I'm going to have the patient shrug against resistance. Good. Now I'm going to go ahead and use or check for deep tendon reflexes. So I'm just going to have you relax. I'm going to be checking the brachial radialis, checking for the bicep. Good. All right, I want you to relax for me, checking tricep. We'll do the other side, brachial radialis, bicep. Good. Tricep. Good. All right, I'm going to have you scoot all the way back, and I'll check patellar. Good. Good. I'm going to check Achilles. Good. Now the Babinski. Good. Now I'm going to be assessing for the vibratory sensation in the patient's wrist, so I just want you to tell me if you can feel this vibration, okay?
Yes. Yes.
All right, now in the proximal ulnar prominence.
Yes. Yes.
Perfect. Now in the medial malleolus.
Yes. Yes.
Perfect. Now I want you to close your eyes, and I'll be assessing for light sensation in the upper and lower extremities. So I want you to just tell me where I touch you at.
Right shoulder. Right calf. Left calf. Left shoulder.
Perfect. Now moving on, I want you to go ahead and stand up. We're going to be assessing range of motion in the hip. So I want you to flex, extend, hyperextend, abduction, abduction, internal rotation, external rotation, and circumduction. Perfect. And I don't know if we did this for the knee, but we'll assess range of motion in the knee. So flexion, extension, hyperextension. Perfect. Moving on, I want you to put both feet together, feet or hands apart. Close your eyes. I'm assessing the Romberg test. Good. Now I'm going to have you walk in a straight line, and then when you come back, I want you to do heel to toe, assessing the tandem walk. Perfect. All right, now I want you to turn around for me and then touch your toes. I'm going to go ahead and assess the spine for any signs of scoliosis, any masseter tenderness. He's already in flexion, so I'm going to have you stand up. Extension, and you can face me now. Hyperextension, lateral flexion, and then rotation. Checking lumbar range of motion. Now we're going to do cervical, so I want you to flex, extend, hyperextend, lateral flexion, and then rotation. Perfect. I want you to hop on one foot. Perfect. Hop on the other. And this concludes my head to toe.